name is Bethany, and I'm going to be working with this presentation today, and then we have Megan and Becca, who's videoing right now. So we're talking about proper tampon use and TSS, or toxic shock syndrome. Okay. We have a pre-test for you in front of there's 7 questions, and we would like you just to answer true or false. Just simple questions, just you may or may not know. First one, tampons hurt. A tampon cannot be go beyond the vagina and get lost inside the body. A tampon cannot get stuck. When properly inserting a tampon, it can't fall out. Tampons cause yeast infections, true or false. You can swim with a tampon. And the last one, tampons cause cancer. So just take a couple of moments and answer that. We'll go over it at the end. We'll see the differences. Everyone, all good? So just some steps to inserting a tampon. You have, wash your hands, soap and water. You want to sit or stand in a comfortable position. Gently push the tampon into the opening. As soon as your fingers touch your body, of course, then that's when you pull the applicator out and the tampon's in. Now, if you have problems inserting a tampon, that's whenever you may need to use a mirror. And if you have multiple attempts you've tried, you are unable to insert a tampon, then you would seek a healthcare provider. So that's some things to proper tampon use. Then Megan, she's going to discuss more about toxic shock syndrome. Okay.
Do any of you girls know what toxic shock syndrome is? It's a rare but serious illness that's caused by a staph infection, which is a type of bacteria, and we frequently associate it with tampon use. About half of the cases of toxic shock syndrome are related to menstruation in some way or another, and the most common age group is anyone under the age of 19. What causes it? The staph infection, obviously, and it is associated with not just tampons, but menstrual sponges, diaphragms, and cervical caps. It can also enter scrapes and blisters or recent incisions. And just to talk a little bit about bacteria likes to grow in warm, moist areas, which if you think about it, what better place than a bloody tampon? And does anyone know why super absorbent tampons are the most likely type to cause toxic shock syndrome? There's 2 reasons. One, we either leave them in for too long, or we don't have a heavy enough flow to be able to use them. So what they do is they don't just suck up the blood, they suck up the normal moisture, and they cause little tears that the staph infection can go through and into the blood system. Who's at risk for developing toxic shock syndrome? Anyone that uses tampons or menstruates, anyone that's recently had a baby, had a surgery, or somebody that's had a staph infection in the past or still has one, and anyone that's not washing their hands properly because we're carrying it on our hands. And then some signs and symptoms of toxic shock syndrome. One of the most common is a sudden fever, and it's usually over 102 degrees Fahrenheit. Being tired, weak, lightheaded, your blood pressure will start to drop. Muscle aches, headache, nausea, vomiting, diarrhea, things that you hear all the time. But remember that just because you have these things doesn't mean you have toxic shock syndrome. And another thing that's common is a rash that looks like a sunburn, or redness of the mouth, throat, and eyes, sorry. And then what happens if we don't treat it? Your organs will start to fail, you'll go into shock and possibly pass away. So the important thing is that if you think that you have it, you need to call your doctor about it. And then Rebecca's going to be talking about the prevention and the treatment.
Bethany already said, prevention, like they talked about with the proper tampon use, you want to make sure that if you are using tampons, you're changing them frequently, and try to avoid the high absorbency ones, because like they said, they can soak up more, leading to more bacteria with a higher risk of getting the toxic shock syndrome. Other thing too is if you ever have any type of surgery and you have a wound or an incision, sometimes they put packing in those incisions or just the staples. You want to make sure that you're changing your dressings frequently, changing the packing, following the directions that your doctor gives you for your surgery. Moving on to the treatment, there's no single diagnostic test that determines if somebody has toxic shock syndrome. Just like if you were to break a bone, how they would do an x-ray, they would say, okay, the bone's either broken or it's not broken. In this case, there's no test to do that. So they look at several different factors to determine if you fit into the category of having TSS. Some of the things that they look at is if you have the fever. They look at low blood pressure is a big symptom of TSS. The rash that they talked about, that's kind of like the sunburn, and it'll start to peel just like a sunburn. And the organ failure. The three main organs that it typically affects is the heart, your kidneys, and your liver. Those are three organs that have a large volume of blood supply to it. The other thing to determine is they would send blood cultures off to determine if you have this staph infection or not. If a doctor were to determine that you had the staph infection, they would obviously want to treat you. It typically leads to a hospital stay along with a visit from a specialist, a doctor who specializes in infections. They would give you steroids to help with the rash and the infection to treat you, along with IV antibiotics. Typically they give clindamycin and penicillin, which are two pretty big antibiotics out there. Those are the two that they give, but obviously in cases of people with allergies, they would adjust that per the patient. They also give a large volume of IV fluid. Being a symptom is low blood pressure. They're going to give you lots of IV fluid and boluses. If for some reason the IV fluid isn't working, they can also give medication either through the IV or in a pill form to help raise your blood pressure some. In severe cases, like I said, the kidneys are a major organ that are affected by the TSS. So in severe cases, some people actually have to go on dialysis for this to help clean out their blood system. And it can be permanent or it can be temporary depending on how severe the case is. Also, it can affect the respiratory system as well. That's probably one of the most severe cases. And in that case, you can go into respiratory distress, which can lead to respiratory failure. That would lead to intensive care unit staying on a ventilator. And if you experience any of these signs or symptoms, or you have any concerns that you feel you may be at risk, obviously we want you all to seek help from your ER, your pediatrician, whoever you go to see, to try to counteract your risk of getting TSS. So we're going to go on to the post-test now. So we're going to have you kind of go back over it again and see if any questions that you may have answered before may have changed. Again, the questions were, do tampons hurt, true or false? Tampon cannot go beyond the vagina and get lost inside the body. Tampon can get stuck when properly inserted, or tampon cannot fall out. Tampons cause yeast infection. You can swim with one, and if they cause cancer. And while you guys are doing that, do you have any questions at all for any of us regarding toxic shock syndrome or proper tampon use?
As you're filling that post-test out, I just wanted to mention that we have, at all the place settings, we have the 2 tampons, just as like in a sample of the absorbencies. We have the small, medium, large, extra large absorbencies. We just have a couple samples there for you. And then we also have this pamphlet. On the front, it just talks about the proper use of tampons, and it has our names on there. And then on the back, it just talks about what TSS is. So after this presentation, if you want to, you can take this with you. They're yours, and you can inform other friends that you may think that need some additional help and whatnot. So anyone find that their answers they answered the first time were different than the second time? Okay, let's go over them real quick and see. So tampons hurt. What do you think the answer is? True or false?
False.
Okay, good. A tampon cannot go beyond the vagina and get lost in the body. True or false?
True.
False.
I'm gonna say false.
Cannot go beyond the vagina.
True.
So that
I feel like it can go beyond. I feel like it can go.
They can't get
farther
stuck in
uphill.
your vagina.
can't get stuck.
What if?
I
thought,
I feel
Like
like
it can't get
that
lost
happens
inside
is-
of you.
What if,
Lost
listen,
inside your
listen,
body, but
let me get me here. What
It's
if
got-
you have sex and you have tampon and then what if it gets stuck? It's
Oh my
stuck.
God.
It's
It
stuck.
can't-
Sorry, it's stuck.
I think that what if
What if it
can't
I don't
gets stuck? It
think
could get
it'll
stuck.
come out.
Is it
I think
possible?
it'll happen. There's stuff
Because,
happens
oh, here,
going
you
to college and they're
don't
saying
forget.
it's, I don't think you'd have
Is
stuff
it
in your
impossible?
tampon in unless you're like
So it's
intoxicated.
I think it's impossible.
It's
impossible for the
You would,
string.
that hurt, you'd cry.
The string,
and make
the
it
string
stop.
could come loose, but you could
What
still,
if it breaks though?
if
You
the
could-
string
you could
does
get it
get,
out.
if the
Squat.
string does break off,
You
though,
did.
you would moisten it and you could pull it out. Of course, you would use your fingers and you'd have to, but if you can't do that, then you would go to a healthcare provider and they could take it out for you.
Wait, so choose true,
Yeah.
right?
But it wouldn't get stuck to where you can never get it
Yeah.
out.
That's
It's not
We
what I
meant
meant.
temporarily.
That's not what I.
A tampon can get stuck. So you answer that true.
Yeah,
Yeah.
it's possible. It has happened to my friend before. So I'm gonna go with.
Okay. When properly inserted, a tampon cannot fall out. Okay. Tampons cause yeast infections.
True. They don't? I thought that
It's
they could.
I thought they, yeah, I thought they
Not that they
could.
do, but I thought they could.
They cause the toxic shock
Okay, that's
syndrome.
the same thing. Okay, okay.
You can swim while wearing a tampon.
True.
Yeah.
Good. And tampons cause cancer. True or false?
False.
Awesome.
My tampon caused me lung cancer.
Alright.
Totally
Good.
This is so bad.
Any questions?
Do you want
Any
these?
comments?
Do you want this covered it?
Good.
This is efficient.
Thing.
Yeah, it was good.
Oh.
It was really good.
Okay.